Hello everybody, welcome back to my channel. Today we are going to learn how to introduce a nasogastric tube or NG tube or Gavage tube or infant feeding tube inside a baby who is not able to feed by mouth. And before putting, we have to select the proper size of the tube. It depends on the baby's size, baby's weight. It comes in 5 range, 6 range, 8 range and so on. Here we have selected a 5-inch NG tube and we are going to put it inside the baby through the nose. Now before putting, we have to measure the length by which we have to introduce. For that, we have to measure from the tip of the nose to the tragus of the ear, and from there to the sternum of the baby. Here it is coming 17 centimeter. Now we are going to introduce it inside the baby's nose. You have to hold the baby's head and introduce it softly inside the baby. We can lubricate it with some normal saline. That is enough. Here the baby is crying because the baby does not feel any pain while introducing this tube. It is just the baby is anxious, that the baby is crying. We have to put it softly. It will go inside the nose, through the pharynx, and through the esophagus inside the stomach. But sometimes it may happen that it goes wrongly inside the lungs. So for that we have to check. You have seen that we have introduced it up to the 17 centimeter, and now we have to check whether the tube is in proper position, that is the tip of the tube is inside the baby's stomach. For that we need a 2 ml syringe. We have to attach the syringe at the end of the tube and push 2 ml of air inside the baby's stomach and hear the gargling sound with a stethoscope. So we are taking a 2 ml syringe and we are putting it inside at the end of the NG tube. It is filled with air. You can see the syringe is filled with air. We are putting the stethoscope on the baby's stomach and now we are pushing the air. We can hear the gargling sound inside the stomach, and we are sure that the tip of the tube is inside the baby's stomach. Now we have to fix the tube in proper position and we are ready to give the baby NG feeds. So fixing, we are using steri strip. We are using two pieces of steri strip. One piece of steri strip will go from baby's nose to the NG tube, and another steri strip will secure the first one on the baby's nose, like this. This is the first one. We are going from the baby's nose to the NG tube, you can see, and the second one will just secure the first steri strip on the baby's nose, like this. So we have to be very careful that the steri strip is properly secured on the baby's nose, otherwise it may displace, it may come out, and if we are inadvertently giving feed, the baby may choke also. So before giving feed, every time we have to check whether the NG tube is in proper position, whether fixation is in proper place or not. So now we are ready to give the feed, and we should change the NG tube every 7 days.